Back now at 6:14. Now to your health. This weekend, the biggest sporting event in Houston will take over the streets of downtown and central Houston.
Thousands have been training for the Chevron Houston Marathon and Aramco Half Marathon. Health reporter Haley Hernandez is here. She's going to introduce us to a mother who's looking to overcome adversity with this race. Haley.
Yeah, guys. So a 40-year-old runner, wife and mother of two, whose life took an unexpected turn when her leg locked up during her last race, says that it stole her ability to walk and left her with a dreadful diagnosis of congenital hip dysplasia.
Carrie Bradshaw has always been a runner, even growing accustomed to aches and pains that come with it.
I had been experiencing a little bit of nagging hip pain, enough where I would limp around for the rest of the day, but nothing that felt like this.
Then one day, it stopped her in her tracks.
I was out for a run and my leg completely locked up, and I had to limp home.
She was diagnosed with congenital hip dysplasia. If that sounds familiar, you may have heard of pediatricians looking for this in babies. That's how early it can be diagnosed. But patients like Carrie can also go through life without knowing they have it, and that's where it leads to complications.
It makes you prone to developing arthritis in the hip. Some folks may develop arthritis in their 30s, 40s, or 50s because they've had that hip dysplasia.
And for that, there's really no good option to fix it.
The only way to really fix it is it's a pretty big surgery where it's called an osteotomy, but you actually cut the hip socket out of the pelvis and move it around so that there's not too much stress on the hip where it'll lead to arthritis. So it's a big surgery, even bigger than a hip replacement, but in some cases it's the best.
Despite that recommendation, Carrie tried with all her might to avoid surgery, turning to pain management with physical therapy, anti-inflammatories, and platelet-rich plasma. Nothing worked. So she had surgery on each hip 5 months apart without knowing if she'd ever race again.
Recovery was tough, especially being a young mom with two young kids. I think that was probably the most challenging part other than the pain.
But Dr. Stocks says technology for these kinds of operations is now so good that patients can return to just about any activity within months of surgery.
Now I've had 3 patients run full marathons, dozens of patients run half marathons, and I'm not seeing any problems with hip replacements.
Carrie has been running again. We were there when she gave Dr. Stocks the first medal that she's gotten since being back in the sport.
But I feel like Dr. Stocks unlocked the second chapter in my running story. It's totally different now, but I have such a greater appreciation for running.
It's a moving gesture as she's on her way to one of Houston's biggest sporting events, the Aramco Houston Half Marathon on Sunday.
The one that is the most meaningful to me is the big Houston Half Marathon that's on January 14th. The whole time when I was navigating this, I was praying for a miracle, and it turns out he was my miracle and changed my life.
All right, Houston, so as many of you get out there and line the streets for your loved ones this Sunday, remember that runners like Carrie, who was basically immobile this time last year, and all someone can overcome in a year to gain the strength to take to these streets. We'll be cheering her on for sure. Sophia and Owen.
Yeah, that's incredible.
Amazing recovery.
Yeah.
All right, Haley, thank you.
Thanks, guys.